Hello everyone, today me and my friends are going to talk about Atridox, that is doxycycline hyclate. So Atridox is a prescription medicine. It is used to treat the symptoms of periodontitis. It is used alone or it can be used along with other medications, along with the mechanical debridement of teeth. It belongs to class of tetracyclines. And it's a broad spectrum antibiotic which is synthetically derived from oxytetracycline. As you can see, this medication is a focused periodontal disease treatment. That means it's delivered in localized tissues. So it consists of two syringes, syringe A and syringe B. And after mixing the both syringes, syringe A is encapped with a blunt cannula. So Atridox is a subgingival controlled release product composed of two syringe mixing system. Syringe A contains 450 milligrams of Atrigel, which is bioabsorbable, flowable, polymeric formulation. Syringe B contains 50 milligrams of doxycycline hyclate, equivalent to 42.5 milligrams of doxycycline. The final constituted product is a pale yellow to yellow viscous liquid and has a concentration of 10% doxycycline. And it should be stored at a temperature around 2 to 30 degrees Celsius. As we can see, syringe B is being injected into syringe A to make the 10% of doxycycline liquid. Thus, the final product that we get is pale yellow to yellow viscous liquid with a concentration of 10% of doxycycline hyclate.
Doxycycline has broad-spectrum antimicrobial profile. It acts on both gram-negative and positive bacteria, as well as on aerobic and anaerobic. For example, spirochetes, mycoplasmas, actinobacillus, actinomycetes comitans, and many more. The liquid solidifies upon contact with the aqueous fluids in periodontal pocket. It becomes controlled release liquid for up to 7 days after that, after becoming a solidified state. And this liquid, it will flow everywhere where chips and fibers cannot go.
Now we are looking for the indications of Atridox. It is used for chronic adult periodontitis for a gain in clinical attachment. It is used for reduction in probing depth, and it is used for reduction in bleeding on probing. The contraindications are pregnancy, infants and children, allergic to tetracycline, predisposition to candidiasis, and general hypersensitivity. Now we are going to look the application procedure. Atridox does not require local anesthesia for placement. The first step is to bend the cannula to resemble a periodontal probe. Then we explore the periodontal pocket in a manner similar to periodontal probing. Keeping the cannula tip near to the base of the pocket, express the product into the pocket until the formulation reaches the tip of the gingival margin. Then we withdraw the cannula tip from the pocket. Upon contact with crevicular fluid, the liquid product solidifies. It allows controlled release of drugs for 7 days. It is a sustained release gel. It suppresses the collagenase, and its application stays for 7 days. The release is for up to 7 days. As you see in this diagram, we bend the cannula like a periodontal probe, and we explore. While we explore, we inject the gel into the sulcus.
Adverse reactions include headache and common cold, gum discomfort, and pain or soreness. toothache and tooth sensitivity, allergic response, and candidiasis. So some of our post-operative instructions we want to give to our clients include limiting the use of mechanical oral hygiene procedures such as toothbrushing and flossing. And we want to tell our clients to avoid any treated areas for at least 7 days. During this time, clients can rinse with an antimicrobial rinse. And if a small amount of Atridox is swallowed, it should not cause any harm. We also want to let our clients know to avoid excessive sunlight or artificial UV light, such as tanning beds, and medication may decrease the effectiveness of birth control pills. Our mechanism of action doxycycline is a broad spectrum semi-synthetic tetracycline. Doxycycline is bacterial static, inhibiting bacterial protein synthesis due to disruption of transfer RNA and messenger RNA at ribosomal sites. In vitro testing has shown that many bacteria associated with periodontal disease are susceptible to doxycycline at concentrations of less than 6 milligrams per milliliter.
Now we are going to talk about benefits. It's minimally invasive, no use of local anesthesia, better experience for clients, better motivation to return for recare intervals, and improvement in probing depth when combined with periodontal instrumentation. In this slide, we are talking about follow-up. Follow-up can be done after 7 to 10 days. Period dressing placed during the procedure should be removed. New probing depth and cal and any level of improvement should be recorded during the follow-up, and application of Atridox must be repeated 4 months after its initial treatment. And finally, we are going to talk about documentation. In documentation, we include the agent name, the composition, the expiry date of Atridox, the time taken during the administration, the allergies, treatment sites, and probing depths and care are recorded, and post-operative instruction is also recorded.